Hi, I'm Clara and welcome to Make Well. Whether this is for yourself, for someone you support, we're here to help you every step of the way. I am now going to introduce you to some of our support staff.
Hi, my name's Jess and I'm part of the family support team.
Hi, my name's Vicky and I'm part of the family support team.
Hi, my name's Emma and I'm part of the family support team.
Hi, my name's Josh and I'm part of the family support team.
Hi, my name is Donna and I am part of the patient services team.
Hi, my name's Julie and I'm part of the family support team.
Hi, I'm Molly and I'm part of the family support team here.
Hi, my name is Sammy and I'm part of the family support team.
Hi, I'm Hazel and I'm part of the family support team.
In this video, we're going to cover frequently asked questions ahead of combined assessment. Our assessments are widely recognised by schools as we follow the NICE guidelines, which is considered to be the gold standards of clinical practice. We have a multidisciplinary team of specialist nurses, specialist social workers and other professionals who are qualified to deliver the assessment. The assessment is going to be broken down into 4 parts. An ADIR with an ADIR clinician, a QB check with a QB assessor, an ADOS with an ADOS clinician, and an ADHD assessment with an ADHD clinician. It is typical for the ADIR to be on a different day, and also a different clinician assessor to complete each part of the process. If you're attending face-to-face appointments, you'll be greeted by our reception staff. Alternatively, if you chose the online format, you will receive a link to the appointments around midday the day before. Please do check your junk box. What is the ADIR? The ADIR is part of an autism assessment. It's usually completed with a parent, a main caregiver, or somebody that has known the patient from an early age. For an adult or an older young person where there isn't anybody to support with the ADIR, please don't worry. We have another way that we can support. We can do an ADIR informed, which is a different approach. We often get asked, will my child and I as a parent get the opportunity to speak to a clinician alone? Yes, where appropriate, we can support that. This also allows the clinician to gain an understanding of the child's communication style in a one-to-one setting. What about masking? Our clinicians are very experienced in recognising masking behaviours. They gather information from multiple sources, such as from a parent, developmental history, not just what they see on the day. The ADIR can take up to 3 hours. The ADOS, the QB and the ADHD assessment can take up to 5 hours. Will there be breaks during the assessment? Yes. We understand that it can be a tiring process. Breaks can be taken. You're more than welcome to bring food and drink. We offer refreshments on site. We have places close by that you can purchase food from. And we're also surrounded by nature. We have therapy horses on site that you're more than welcome to go and see. Will I get bored? We try and make the activities as engaging and appropriate as possible. While some parts are structured, our clinicians are experienced at keeping things comfortable throughout. Can I bring someone with me? Yes, you're more than welcome to bring a supportive family member. We ask that you let us know in advance where possible. Is there anything I need to bring with me? Please bring anything helpful. Reports, school information, comfort items, or anything that you may need throughout the day. Is preparing for the assessment. We like to remind families of the Little Red Child Record for Vaccines and Milestones book, to also look back at photos, particularly around the ages of 4 to 5, and then to think about significant events such as house moves, pregnancies, major changes. This helps with recalling timelines and development. Afterwards, can my child go back to school? Yes, if they feel they're able to. However, some families choose to let their child rest after, but it's entirely up to you. Will I get an outcome on the day? In most cases, you won't get an outcome on the day. Our team need to go back and review all of the information before they provide an outcome and the report. When will I get the report? Reports are typically completed within up to 8 weeks. On the rare occasion that this may be later, we will get in touch with you to inform you of this. If you have any other questions after watching this video, please do not hesitate to give us a call, drop us an inquiry, we'll get straight back in touch. I hope you've enjoyed watching. If you have